Before we get going on today's interview, if you're not already reading Must Read Alaska every day, you're missing half the story. Must Read Alaska is where Alaskans go to find out what's actually happening in this state: the politics, the policy, the people, without the spin you get from the legacy press. Just straight talk, Alaska first. You can support Must Read Alaska with a subscription. Use the code THESOCIAL10 at checkout, and you'll take 10% off our In for News or All In annual plans. That's THESOCIAL10, the social 10. Go to mustreadalaska.com, hit subscribe on your podcast app, and keep Alaska's most trusted independent news source running.
Welcome to The Social, Must Read Alaska's segment on the events, communities, and conversations that make this state worth living in. I'm Todd, your host for today's episode. More Alaskans are hunting, fishing, foraging, and growing their own food, not because they have to, but because of a decision about what kind of relationship they want with what they eat. It's not a trend, it's a value shift. At the beginning of May, the Culinary Institute of America and Stanford Medicine brought together chefs, physicians, dietitians, and sustainability researchers in Napa, California for the Food is Life, Food is Health Summit, a 3-day gathering built on one idea. Food is the most powerful health tool we have, and doctors and chefs need to be working from the same playbook. I've got two guests today, Miss Kristen Rasmussen. She was a central organizer of that summit and a spokesperson for the Culinary Institute of America, and Miss Brenda Josephson, a Haines-based Culinary Institute of America trained chef and the author of Must Read Alaska's own Foodies and Foragers column, someone who's been living this philosophy right here in Alaska for many years. Welcome to both of you.
Thank you. Thanks for having me.
Yeah. No, this is really fantastic. The Food is Life, Food is Health conference, when Brenda had first approached me about this and just looking through the agenda, like it was a very fascinating concept when you start thinking about, you know, bringing chefs and bringing physicians and like how do we make this into something that could be extremely beneficial to society. So Kristen, tell us about your role here at the Culinary Institute of America. What brought you to help organizing this summit, and then why do we need this now?
Yeah. So my background, I'm a registered dietitian, nutritionist, but I've always been in the culinary nutrition and food sustainability space. And, I started my career in nutrition because I love food, and it was kind of an anomaly to be a dietitian who loved food at the time. And that's since really dramatically changed. I think the same as with others in healthcare. And so these worlds are kind of naturally finding each other, but there's also
Hmm.
this huge gap. So I'm the program director for Food is Life, Food is Health, that summit that we're here to talk about today. I'm also assistant director of health and sustainability programs at the CIA more broadly.
Hmm.
But so this summit was designed to bridge that gap and break down these silos, get chefs and healthcare professionals together, sustainability experts, researchers, educators, to really gather around this big idea of that food is foundational to human and environmental health. On the human side, I think everybody kind of recognizes that food is good. Certain foods will make you feel better, and certain
Hmm.
foods will make you feel worse and contribute to chronic disease. But you go to the
Yeah.
doctor and they don't really talk about that. We actually had um, a physician at the summit say, "I've never talked to my patients about food. This never comes up." When
Yeah.
when you look at the chronic diseases of today, they're all about food. And then on the opposite end, you have like culinary training, which, we're the CIA. We pride ourselves on being the best culinary school in the country or the world. And I think that's true. But we're really advancing our curriculum to
Hmm.
bring it into the 21st century and focus on foods that are delicious. We know taste is the most important thing, but then also are good for your body, good for the planet. So it's kind
Yeah.
of from two angles, like more healthcare professionals or I should say like more physicians, dietitians already are talking about food, right? Or nurses,
Hmm.
PT, OT, they're recognizing how important food is. And then on the culinary side, they're recognizing how the health factor is such a big piece to the puzzle. And so we created this venue for those conversations to happen and for people to learn from each other and create change together.
No, that's fantastic. As I was going down through the list and you talk about the health and the food side of things and the taste, right? Is I think people would be very interested to find that, you have the Culinary Institute of America and then you got Stanford and Harvard, some very
Mm-hmm,
prominent people
mm-hmm.
in both spaces. So I think this is going to be
Absolutely.
great. Now, Brenda, you're continuing your education with the Culinary Institute of America, and you write about foraging kelp and growing fava beans in Southeast Alaska. So, can you help us here with how do you connect what you do here in Alaska with what the summit is trying to accomplish here nationally?
Yeah, well, I love the wild and natural foods. And what I really like to do with the Foodies and Foragers column is just one, introduce everyone to rather reintroduce the public to all the great varieties that we have here in Alaska of very nutrient dense wild and natural foods, as well as encourage people to get out, do the gardening, do the foraging. Um, it's an easy win with the wild Alaska salmon. We've got access to some of the best seafood that you
Mhm.
can reach to, but we also have access to a lot of great greens. And for me, my interest, the reason I've decided to go back at this point to do the culinary therapeutics program that the Culinary Institute is offering is I really wanted the additional nutrition training as well as the science-based facts to approach what we've been doing and what we know innately too, so that I can help others.
Yeah, and I think you both kind of touched on a really interesting point that I think a lot of our readers and people that are listening to the podcast are probably starting to tune into a little bit more is there's just this skepticism about the institutions, right?
Mm-hmm.
We've seen over the last several years this change. I mean, the Maha movement right now is probably the most visible one, where we're looking at various ways of approaching health that's not just going directly to some kind of a medication, right? And to your point, Ms. Rasmussen, about doctors not talking about the food or maybe not having the tools of it and bringing that back into
Mm-hmm.
the conversation. So this summit put the chefs and the physicians side by side in the same kitchen. Why has that not happened at scale before, and what does this actually change?
Good questions. I think I think it hasn't happened because maybe we were in different spheres, and you think
Hmm.
about what people. So okay, you think about when chefs became a thing. People started going to restaurants. It was very infrequently, right? You did
Hmm.
it. It was a special occasion. Chefs were trained in these like classic French methods that are like very decadent,
Hmm.
which are fine and have a place in our world. But that's kind of the status quo and what has been happening for a long time. But now we're in a totally different era where people are eating out more often. And we
Hmm.
have all of this chronic disease because we live in a land of plenty. We're not like hunting and foraging everything and need as many calories as possible. We have the whole industrial food system. There's so many reasons why we've gone where we are today. So I think now more than ever, we need this, but it didn't originally start out that way. It was like you have your food at home is very different than your food in, say, a restaurant. And so with this summit, we're really trying to show that we need to have both of those angles happen
Hmm.
simultaneously and have these conversations together to make this change. So I think everybody can agree that food brings people together. And at the summit, the energy was so amazing. I mean, I can't, and Brenda can maybe speak to this as well, but it just felt like this just such a positive like party where everybody was working toward the same goal. And it wasn't just a normal conference where someone's on a lectern talking about their
Hmm.
research. And it was very dynamic, super hands-on. And I think people are craving human connection. They're also craving connection to nature. And so bringing in this, foraging, wild foods, traditional foods piece, it's just like satisfying this need that we all have. We're all so virtual. And I think that was what was really made the summit different. And I do a lot of foraging in my personal life. And I love how it connects me to the season. I live in Northern California, so it's a little different seasons than Alaska, but it really does connect you in a way that you don't get in modern society. So I think there are a lot of things happening here, but I think where we started was these two very different worlds. And healthcare was there to solve a need, to solve, like, you get a sickness and then you go to the doctor, rather than creating health and setting you up to thrive. So now we need to like get back to that.
Yeah, as you were talking, this visual came into my mind of just what the doctor's office would look like if there was a kitchen versus like the cabinet of pills.
Yeah, yeah.
How as a kid
Yeah,
I might have been more inclined to eat vegetables. It was like, hey, why don't you come taste this like orange fun thing over here and it'll actually
totally.
help with your
Yeah.
eyesight. You speak about the foraging. You said you had a pretty interesting experience there at the conference. Can you tell us about that with the foraging?
I would love to, because I've been secretly wanting to do this session for so long. A chef that I work with at the CIA, Rebecca Pizer, she's a professor in the program. She actually teaches in the Culinary Therapeutics program. And we met because I've been working in different capacities at the CIA for about 10 years. And we met working together on a different program, and we just bonded over foraging. And it's such a cool way to bond with other humans. I think we always send each other pictures of different things we're picking. It's like, oh, like nettles on the trail today. And it's like you're bonding with each other, but also with nature. It's a really just a special way to connect to people. And so
Hmm.
we had this session where we, people were kind of our team really wanted to make sure we covered our bases from the safety end of things. And so we had a presentation with, like, lots of disclaimers and then pictures of things you can do. And we talked a lot about how I think that in the culinary chef world, when people hear foraging, they automatically think of like Scandinavia and fancy restaurants. And so we
Yeah.
really tried to debunk that from the get-go and had some pictures. I have spent time in Denmark, but I spent a year in Oaxaca with my family. So lots of like pictures of all the different traditional wild foods they eat there. So it's, demonstrate all these traditional cultures eat wild foods. It's not this invention of a fancy restaurant in Copenhagen. So kind of debunking that. And then we went on a walk around campus, just like a 20-minute walk from the CIA. It's right on the Napa River. And there was just, we lucked out that it wasn't super dry time of year. So there's just tons of stuff, like so many things. And we pointed out, we had samples beforehand for they could taste different kinds. We had like wild dandelion versus conventional dandelion to see what the flavor differences were, and all
Hmm.
kinds of different things. And then we came back to campus and did a cooking demo of like a phyllo pastry hortopita of wild greens and cheese pie, and also walked around the garden and pointed out the like weeds, the quote unquote weeds, or like wild edible greens growing in the garden, to show, it's not just on these trails, they're also growing in your garden, and you can choose what's a weed or what's not a weed based on whether you use it or not. So it was a super fun session. I was really happy that we got to do that. And I think people enjoyed it.
Yeah, no, that's great. Yeah, I was before we were talking here, I was sharing about kind of my experience moving up to Alaska and how
Mm-hmm.
when you're foraging, right, this was just a common everyday thing that you would do with your friends, right? You would go out on the
Yeah.
weekends when the berries were ripe or going to pick mushrooms. So it was cool that you got to have that, and I appreciate you sharing that. And before I get too far down the track, because we could
Right,
talk
right,
about
right.
foraging and all
Foraging,
these fun
yeah, of
things, and I
course.
know Brenda's
Yeah.
got a whole bunch of stories. Let's kind of go back to the summit a little bit. So
Yeah.
most of our listeners may not have heard about this, but if you could paint this picture for us, who was
Yeah.
in the room? What did you guys do between May
Hmm.
6th to the 8th? And what
Yeah.
was the vision behind putting this all together?
Yeah. So as you mentioned, as a partnership between Culinary Institute and Stanford Medicine. So we had several presenters from Stanford Medicine. Christopher Gardner is a co-director of the conference. He's really well known in right now, the dietary guidelines feedback space, because that's been such a hot topic. He talks a lot about protein and
Hmm.
health, nutrition. He's in a Netflix series. He's all over the place.
Oh, wow.
And so he was a big part of the conference, planning, organizing, everything. And then other people from other researchers and clinicians from Stanford Medicine, also with the Dorr School of Sustainability at Stanford. So we had some members of their department as well giving presentations. And then Harvard T.H. Chan School of Public Health was there. So we had these we talked about people not trusting institutions. This did have a very heavy institutional backing. But I think,
what a great way to
right, I
restore
mean,
trust, right?
totally. And I think what's cool about it is that they are giving this backing. So it is, kind of like how you frame this whole podcast episode is like, wow, they're starting to pay attention to this. And it's
Absolutely.
not, I in no way want to say that these, professors from Stanford and Harvard are inventing these different concepts. They're just starting to put research dollars to it, attention to it. And I think what's cool is like, Brenda mentioned Justin Sonnenberg, and a lot of his research is looking at, it's all about the microbiome and fermentation and how people who foraged and hunted and gathered, their microbiome was so much healthier. And we think that we have it all figured out, but really we need to look back to these cultures. So sorry, I'm getting away from this question.
Oh, you're good.
So as an example, we tried to pair an academic presenter with a culinary presenter wherever possible. So as just one session example, we had Tomiko Katsumoto as a clinical associate professor at Stanford, and she researches plant-rich diets and is really huge on the scene, talking about how just the more plants are going to set you up for longevity and how healthy plants are and stuff like that. And then we paired her with Chef Sophia Sada, who is a CIA professor from San Antonio campus. And they had such a great session because they'd never met each other until this conference, but their messages just really jived. And it was two very different cultures, like Japan and Mexico. And Sophia did this great cooking demo on stage. And then Tomika was talking about her patients, and it was all about culturally responsive patient care. And so it's really just putting all of these concepts together with these different partners. And our keynote session was another great one with Chef Gregory Gourdet, who's a CIA grad and owner of Khan Restaurant, 3 times James Beard, all that good stuff, chefy stuff.
Wow.
And these two rock star dietitians, Brianna Colleen, who's at Food and Wine, and Maya Feller. And they're both really awesome. And then Christopher Garner was on that panel too. So we had sessions like that with people from all across the field, which is very unique at a conference. But then we also had hands-on kitchen sessions, which I know Brenda attended, the antioxidants and African cuisine one. We had one with a Karuk native, Sarah Calbosa Olson, and we had field excursions. We had a microbiome walking tour where people went around downtown Napa and heard about different fermented foods and went to Rancho Gordo beans. So it was really super dynamic and kind of there was a lot happened at once. Let me just say that.
I was gonna say, what really kind of caught my attention is this hands-on display. Can you kind of go into a little bit of that? Describe what a hands-on display or learning or the flavor discovery labs.
Yeah. So we did it. I mean, it kind of depended on the session. We did it in a bunch of different ways, but one session that we were really excited about that everybody people liked everything, but this session is jumping out at me because it was unique to us. And it was radical portability teaching kitchen, something I might not be saying exactly right, but radical portability, how to have a teaching kitchen anywhere. And we held this session outside, and our intention was to make it as low tech, minimal input. There's not a bunch of CIA students helping you set this up, and you don't have a big fancy $1 million kitchen. It's just a folding table and some a cutting board. And then we had some presenters from the Teaching Kitchen Collaborative, one from the University of Vermont and one who works with the Teaching Kitchen Collaborative specifically. And they presented on they did a demonstration of look, you can do a teaching kitchen lesson anywhere. And so it was really cool because those attendees got to see them do this and could think in my clinic, I could set up a folding table. I can do a cutting board, and I can have a cutting board and a knife and a bowl and some ingredients. And they started their session with this really cool tasting panel with strawberries and different things to pair them with. And then they showed this build a better salad whole lesson. Everyone got to taste it. So that was one example of how we could do that. So it's from that to where it was more demo and kind of interacting, but not cooking, all the way to our like 2.5 hour hands-on kitchen sessions. So it was a kind of a wide array of opportunities.
So my idea about having like a kitchen in the doctor's office is not that
Oh,
crazy
it's
then.
happening. It's happening. It's happening. Yeah. And it's and this is, I think I'm sure you'll ask about the future, like what we're looking forward in the to in the future, but
Yeah.
we definitely are hoping, that happens more and more because people are realizing that it's better to prevent these chronic diseases than to deal with them after the fact. Also, it's
Absolutely.
fun and people love it. And who doesn't want to have like a positive vibe at the doctor's office?
Oh, exactly. And
Yeah.
as you mentioned about kind of being outside, right? And I think about just this last summer, for example, when we go salmon fishing here in Alaska, one of the things that we do is we harvest a lot of roe because we really like the caviar
Cool.
and there's just
Yeah.
so many
Awesome.
things you can do. And,
Hmm.
you know, Alaska tends to just be this living laboratory that kind of builds on this conversation you just shared. Like, hey, we're going to get a
Hmm.
folding table and a little, grill going. And now you guys have demonstrated the medical side of things and pointing out some of these benefits. And, you might have some of the Alaskans here that would say, well, we didn't need this Harvard study to tell us that
Right, right, right.
salmon
Of course.
and
Yeah.
veggies and all these things were
Yeah.
good, right? We've known this for years, but,
Doesn't
I think
hurt.
it doesn't hurt,
Well,
right? It
yeah,
backs it up for you. So,
yeah,
Brenda,
and what's changed about that? Really, it's 50 years. In the last 50 years, we've
yeah,
had all these processed foods. There's been a significant change in our diets. And what has come with that change in our diets with these processed foods, where we've gotten away from the whole and natural foods, is the chronic diseases.
Yeah.
yeah,
So now that we're acknowledging the chronic diseases, and
mhm,
we've got the scientists saying, hey, here's the research for why we're having these chronic diseases, where
mhm,
this wasn't part of the conversation in the past
Yeah.
because it didn't need to be.
yeah,
And now that is why now's the time, is because we've got the history, we've got generations of watching our health decline, along with the way that we eat.
yeah. No, and
And
that's great. Go ahead, Kristen.
I think having this research will really help, hopefully, for organizations, these like indigenous organizations, to get more funding because they can say like, oh, look, this Harvard study shows us it's healthy, so then that means that we should do X, Y, Z in our community. So I think that it can just build more momentum for those types of things. I'm hoping.
Hey, Alaska. This is Todd with Must Read Alaska. In our state, we know emergencies can hit fast, whether it's a winter storm, remote travel, or just being hours from care. That's why we are excited to partner with The Wellness Company. Their medical emergency kit gives you peace of mind with 8 life-saving prescription medications right at home, like certain antibiotics, antivirals, and antiparasitics, plus treatments for a wide range of common illnesses. It includes an expert guidebook so you know exactly what to use when it matters most. No more scrambling when the roads are bad or important medications become scarce. Be prepared like a true Alaskan. Right now, listeners get 10% off plus free shipping on every order. Just go to twc.health/Alaska and use the code Alaska at checkout. That's twc.health/Alaska, code Alaska. Stay ready, Alaska. Yeah. Well, I think kind of look into Alaska here for a second, and we've got a lot of the traditional knowledge that's been passed down. And Brenda, I'll kind of look to you here because you've got some pretty interesting experience. And I know in the last year, I can remember you writing, about one of the new kelp farms that was down there in Southeast. But we've got Devil's Club are all around. We know that this has been a traditional healing herb for things like diabetes. Coastal communities have been harvesting kelp, and the state of Alaska had passed legislation to kind of help grow a lot of the aquaculture, I think is the theme. So, as you both have mentioned, right, modern science is now really coming in and they're adding this new layer of what health and wellness and diet and everything does, and how it can really change the perspective of everybody. So Brenda, now that we see kind of the medical and the culinary institutes coming together and they're catching up, what are some traditional cultures, especially maybe here in Alaska, that, have been doing these things, but maybe some examples of where we're seeing the benefit of the nutrition come through in the diet and the local, local vegetables and things like that?
Yeah, and when it comes to the Alaskan diet, especially the traditional Alaskan diet, it was completely healthful.
Hmm.
Even seal oil is omega-3.
Hmm.
And getting back to, do all these plants have great benefits that we're able to, that grow wild in our foraging? Absolutely. But when it comes really down to the basics, is we've got to start eating a whole and natural foods. We've got to start moving away from the processed foods. Alaska is poised. An excellent example I can give you is the
Yeah.
sunshine hulless barley that we're growing up in Delta Junction.
Yeah, that's
Um,
a great one.
it's a great one, and it doesn't compare with the commercial barley I'm able to get down in the lower 48, and that's right here, and that's an Alaskan product. That on top
Cool.
of all of our wild seafoods, and what has been sustaining us with the berries and all the
Hmm.
wild greens that we get. And one of the things that it's fun when Kristen mentioned walking in the garden and talking about what's a weed.
Hmm.
Chickweed is something that
Hmm.
I used
Yeah.
to pull out of my garden and dispose of.
Yeah, we definitely found some
Now I
chickweed,
save it.
that's for sure.
Yeah,
Yeah,
now I save it. I used to pull it out and feed it to my ducks, and now
yeah.
it's like when I'm weeding the garden, that chickweed, and think of all the gardeners working so hard to
Oh my
grow
gosh.
their
And
greens
farmers.
and
Yeah.
disposing
Yeah.
of that.
I mean, I think chickweed's a good one too because it's not bitter at all. I think that's like a good because
Fresh
some of
and
those greens can be,
clean.
yeah,
Yeah,
totally
it's fresh, it's green, it's delicious. It's
silky.
absolutely, yeah, it brightens up your salad naturally without the bitterness. And I think of all the years I was weeding and disposing of it. What a waste. And the
Yeah.
dandelions,
Oh yeah.
dandelions aren't invasive to Alaska. 100% of the plant's edible, which is kind of rare when you're foraging.
Yeah,
You can eat
totally.
all of the plant with great health benefits.
I actually have this weekend, I'm gonna make dandelion wine. I have a ton of dandelion flowers in my backyard. And I
Oh.
haven't done that in a while, and I'm really excited about it.
You know, I like that you mentioned that, Kristen, because like we see these things and there's just so many different variations, whether it's tea, whether it's tincture, whether it's wine, whether it's some kind of, at the Homestead conference that they're going to have here in Palmer here later, there was a lady that's going to talk about making a sourdough bread from things she foraged right there around Big Lake, right?
Oh my
And
gosh,
there's
what a
just this,
fun conference! But
yeah.
there's a lot of interesting people at that thing, at
Yeah,
that
and
event.
so just so many things, and I think flavor is a really good one, or maybe a really big one. And so when we're kind of talking about this kind of the traditional knowledge and global, you guys brought in people from across the country, from even looks like from across the globe. But what were some of the unique things about maybe combining flavor and nutrition
Hmm.
that might be good for everybody to know that kind of complements the Alaska Native perspective that Brenda shared?
Yeah, we had another session that I've always been dreaming about. We had a session about bitter and
Mm.
how to get, because we know a lot of these foods that are so healthy have that bitter component to them, and it's just
Hmm.
not naturally something that we're drawn to. And
Yeah.
so they talked about, so this is a great example of this tie-in where it's like the health aspects, but then bringing in, okay, we know that it's good for us, but just because we know it's good for us doesn't mean that you can get your patients to eat it. So what are some like culinary like techniques you can use to alter those bitter flavors so that because
Hmm.
everybody has different palate, right? So to alter it, so like using acid or cooking or having a honey vinaigrette, or they were looking at radicchio and dipping it in all these different things, or roasting. Like I know some people will eat roasted broccoli with lemon juice squeezed on it, but not raw. So kind of just like those simple techniques you can do, and I thought that was like a really fun way
to bring the flavor concept in. And yeah, flavor is everything. I mean, there's a lot of other factors that go into why we eat what we eat. Our culture. One of our presenters, Ali Buzari, who's a food scientist that is really great. One of my buddies, and I'm trying to remember this quote, but it's like flavor equals taste, smell, and your baggage. So it's like these very technical things that are changing your perception, but then also everything that's happened in your past, because you had a bad experience with radicchio one time, you never like it again, or because your parents prepared mushy Brussels sprouts, you don't like them.
Yeah.
So, you could have a whole conference just on that, but.
Yeah, that's for sure. And so as we're sitting here and talking about just how food really does bring the society together. I mean, they're from the traditions that we see across the United States, the various cultures, like food just naturally will bring people together. And then you have this layer now of the health aspects where we can really change people's minds about what overall wellness looks like. So what what was a moment from from the 3 days that you guys had the conference there earlier in May in Napa that best illustrates why this kind of collaboration between what chefs can bring to, a tasty, just wonderful meal, and then the medical professionals that are looking at the nutrition, the vitamins, like all of the things that are in there. Can you share a moment that really defined this for us?
Brenda, as attendee, do you want to start with something
Well,
that maybe jumped
yeah,
out?
I'll be happy to share that moment. For me, it was the presentation that Justin Sullenberg gave on the microbiome research he's been doing.
Mm,
And it affects everything physiologically as well as the gut-brain axis.
mm,
And
mm,
it was something that was very basic to Alaskans. It's really about the fiber and the fermentation. In Alaska, we do a lot of fermentations
yep.
for preservation purposes. And I would also argue for flavor, because we do
Mm-hmm.
that's a great way to get some fabulous flavor. But
Hmm.
when I was sitting through his presentation, I had a notepad that I took to every one of the presentations, and my notepad was full. And I knew I had his slides, access to his slides afterwards. I to hear the research that they've done and how they're able to connect it to our health, um, more than just our metabolic health, but our emotional and our um, the brain connection. And then
Mm-hmm.
that was followed up by one of our kitchen presentations, one of the 2.5 hour presentations on koji fermentation.
Mm,
Um,
Oh, good. I'm glad you got to go to the Koji one
yeah,
with Mara.
yeah.
Yeah.
And so Mara King was, and I've done. We do a lot of fermentation because I'm an Alaskan. And I do a lot of subsistence, so I have to figure out how to preserve as best I can. Um, and I've never even thought about doing koji before, and just the way it was broken down, how simple it is. And I was
Mm-hmm.
thinking, not only can I do this, I can help other people learn how to do this,
Awesome. Yeah.
and the great flavors that came from it. So for me, is it a health
yes.
benefit? Is it going to help our gut? Absolutely. But man, what a great way to bring new flavors and desirable flavors to the forefront and to help others. So it's totally going to be an article one day. First, I've got to make sure I can master it, or at least get conversant in koji. So,
Conversant
but
and Koji. That's your title right
yeah,
there.
that's right. That's right. But for the science for the scientists to come forward and say, here we can explain how important a healthy, diverse microbiome is to your overall health and well-being, and we know how to help you reset it. If you've got a microbiome that's not that healthy, that's okay. It's we can help
Yeah.
you reset it with a
Hmm.
variety of the fibers and the fermentations. So to me, that was the biggest aha moment.
Yeah, I
Wow.
think that is really powerful too, because the research shows that our microbiomes are messed up. They're not they're not healthy like they used to be. But what's
Hmm.
so cool is you can change them. I mean, how lucky that that is possible, you know? And so I think having that culinary element is so important. And just piggyback on what Brenda said, with the koji and all the flavors that you can create, it's also a way to, you know, you could reduce the sugar and things by adding these different fermented foods, reduce the salt sometimes. It's a really like an amazing tool to have in your like healthcare toolkit. You know, I know you're learning that at the culinary, or learning more about it at the culinary therapeutics program, but I think these things, we treat them like separate
Hmm.
concepts, but they could really work together so beautifully. But I wanted to bring in the sustainability piece because we haven't really touched on that, because
Yeah.
there's a lot of overlap there as well. Is that just naturally, oftentimes, even with fermentation, we don't talk about this a lot, but people don't ferment because they have refrigerators. When you didn't have refrigeration or other tools for preserving things, you had to ferment. And so
Hmm.
we've lost those benefits because we have this new technology. But when you ferment, you're also reducing the energy usage. So there's
Hmm.
kind of interesting sustainability aspects there. But the biggest one is just the, you know, more plants and less meat is really just monumentally effective. And doesn't mean
Hmm.
you have to be vegan, as we're constantly promoting like plant-rich diets, because we know how important it is for flavor and tradition and
Yeah.
all of those things. But I think that sustainability piece is really important too. And one of our speakers who's from Eat Lancet, he brought up that he brought 2 points I really liked. Fabrice de Klerk, that he brought up, food, which is should be the entry point into health, is really our
Hmm.
biggest risk factor for poor health. I thought that was
Wow.
really like
Yeah.
well put. You know, where we should be using like food is just like this amazing tool to make us healthier, and it's actually doing the opposite. So it's like a missed opportunity there. And then just the fact that like the biggest change, like one of the biggest levers for sustainability change and climate and reducing climate change in the world, is to change our diets. Like it's not about this expensive, you know, getting a bunch of solar panels or changing your car. It's really these like dietary changes. And so if we can show people that it's delicious and fun, then that's really powerful.
Yeah. Very good. Well, I think, all these concepts, they seem so simple that I'm sure everybody is kind of like, well, why haven't I ever thought about this before, right? Like food, something we consume multiple times a day and oftentimes without even thinking about it. So, Kristen, what does success look like? I mean, we've gone through this whole, outline, the event, the specialists and the experts that have come across the world to be there at this conference, from the kitchen and from the doctor's office. But what does success look like in 5 years? Like, how does the culinary and therapeutics, what we look at in terms of the setting, from hospitals to schools, like, can you paint this picture for us and give us
Yeah,
kind of a future of how this conference would really set us up?
there's a lot of things that we're thinking. I mean, first of all, I hope that food is first. And I hope that when you are talking to your doctor or a healthcare professional, that they don't they aren't looking for the pill to solve everything, that
Hmm.
it's just ingrained in our society that our food system is set up so that the healthy choice is the easy choice, the delicious choice is the easy choice, and you don't need those reactive medications. And that your doctor talks to you about food. Your healthcare professionals consider food as like a key feature to health,
Hmm.
and not just as an afterthought. I mean, we brought up teaching kitchens. I think, you know, teaching kitchens in hospitals. There's plenty of hospitals that have them already, in schools, and especially for younger children, getting them started early. We all know that the exposure to healthy foods and fruits and vegetables and beans and all that good stuff early on leads to healthier eating later. And then these, the culturally responsive aspects of it too, is that are traditionally in the U.S. We really, we show this healthy diet in the dietary guidelines or whatever, and it's very one-sided, very like Western approach. And our culture is just increasingly diverse. And these traditional food cultures around the world have incredibly healthy diets for the most part. And so really factoring all of that into the equation. But I think at the end of the day, I hope that what changes is when people say healthy food, you don't immediately think of something that you don't want to eat. But I hope that healthy food can become
Yes.
synonymous with good taste, and that something you want to eat, not just you do it because you have to or you think you
That's
have to.
fantastic. Yeah, I think that you nailed it right there. So Brenda, what would you say to an Alaskan who's already doing all these things to help them understand that food is medicine?
Well, if they're already out hunting and they're foraging, they've got a major leg up because, um, quite honestly, it's eating good health and it's keeping movement, getting out, breathing fresh air. They've got a great leg up already. And my advice is keep eating as close to the earth as possible. And it's about nutrient adequacy. We've got to get the proteins we need, the micronutrients, our greens, and my advice is fiber and ferments. I'm really a big believer in it. We ferment eggs, and they're actually
Hmm.
delicious. So
Mhm.
it's one thing, feeding our microbiome. We can feed our microbiome with the fibers, and we might not have the good microbes that we're feeding. So we've got to give it both. So
Mhm.
my advice to them is keep hunting, keep foraging, keep eating the whole foods, and keep the fiber and the ferments in your diet.
Oh, that's fantastic. Well, we're getting close here to the end of our time, and I think before we go, I think there's probably a lot of people that would have this question, and I'm one of them. So I'm going to go ahead and take the liberty to ask this one. But lightning round, right off the top of your head, is what is the one food that epitomizes food as medicine to you? And I'll start with you, Kristen.
Well, you just let me choose one. So I'm
Hmm.
just going to say beans.
Oh, all right. Brenda, how about you?
Yeah, and I can appreciate what she said, but I'm going to have to go with a wild Alaska salmon.
Fantastic. Beans and salmon. That sounds
That
like
sounds
a
great. Let's do
fantastic dinner.
it.
Oh man. Well, this has been so fantastic. Kristen, thank you so much for taking the time to meet with us here today. Before we close, how can people find out more information about Food is Life, Food is Health?
Our website is foodislife, foodishealth.org. More information there. And if you are interested in this summit, I highly encourage you to join our listserv, our mailing list, because we'll let you know when registration opens. And we did sell out in this first year, and I'm expecting it to be even more popular next year because everybody is hearing about it. But we want you
Fantastic.
to come. We want different groups of people. We want the farmers and the fisher people and the foragers and the nonprofit workers. We want everybody.
Well, you mentioned a lot of things here that I think you've put the challenge down for the Alaskans to come to the table, especially in this
Yes.
teaching
Yeah.
kitchen. So, no, this is really good. And Brenda, how about you? Where can people follow the work that you're doing? I know Must Read has been very grateful, but is
Yep.
there other work that you'd like to highlight?
No, just look for my articles. Must Read Alaska, Foodies and Foragers.
Fantastic. Well, everybody, that is Miss Kristen Rasmussen from the Culinary Institute of America and Miss Brenda Josephson, Must Read Alaska's own Foodies and Foragers contributor, joining us today. The Food is Life, Food is Health Summit. It was held earlier this May, May 6th through the 9th in Napa, California. You can go to their website to find out more. And as Ms. Rasmussen had stated, they've got the newsletter there where you can follow on for the next conference that may be coming your way. And for more on food foraging, growing, and cooking closer to the land right here in Alaska, look out for Brenda's columns. I'm Todd. This is The Social on Must Read Alaska. We'll see you next time.